The FDA's recent approval of a new generic version of mifepristone, the pill used in more than 60% of U.S. abortions, is now facing some political pushback. Some Republican lawmakers urging the Health Secretary, Robert Kennedy Jr., to suspend distribution and reverse the FDA's decision, calling for what they describe as a return to pre-Roe versus Wade standards.
To discuss this, we're joined by Dr. Kristin Lyerly, an OBGYN in Wisconsin and board chair of the Committee to Protect Healthcare. Dr. Lyerly, let's start with telling viewers what mifepristone does.
Mifepristone is a medication that we use for abortion care, but also to manage miscarriages and in other settings. And it's a progesterone blocker. So it blocks one of the essential hormones in pregnancy. It's part of a 2-medication regimen that I use commonly in my practice as an OBGYN doctor, as I said, to manage miscarriages and to provide abortion care.
So we know the FDA reconfirmed mifepristone's safety just 2 years ago. It's been around, in fact, for a quarter of a century. So what's the basis for Republican lawmakers to call on the health secretary to review this drug again?
Politics. I mean, just to say it in one word, politics. This is a medication that has an incredibly safe profile. It's been around for over 2 decades. It's been used all over the world. This is the medication that some people might remember as RU486. The risks of a serious complication are less than 1%. It's 10 times safer than Viagra. It's even safer than Tylenol. This is a life-saving medication that, again, we know is safe and effective, but politicians don't want people to have it because of the abortion debate. Let's be honest. This is part of Donald Trump's backdoor abortion ban. He knows he can't do it through the front door. He knows that Americans will push back. We've seen it over and over and over again in ballot referendums. So now they're trying to do it in tricky little ways like this.
And we know that clinics and rural hospitals are disappearing across the country. So with that being said, what would it mean for your patients for access to abortion across the country if the FDA restricted this pill?
Hey, I work in a rural hospital. I work in a rural hospital that's on the brink. Remember when HR 1 was being discussed and the University of North Carolina published a list of hospitals that were in danger of closing for a variety of reasons? One of those is my hospital. We struggle to get doctors to come up there. We struggle to get nurses who are qualified to be able to work there. Patients have a really hard time getting access. So this is about so much more than just mifepristone. It is about healthcare in general. It's about preventive. It's about rural communities being able to get the care that they need. But when it comes to abortion care in these rural areas, it's simply not there. Abortion care is offered in cities and it's offered often through the mail. And that's how I provide abortion and miscarriage care for my patients in this rural community. I tell them to go to the internet and to order their pills. It's much easier that way for them.
Why is your hospital and others on the brink?
So for a variety of reasons. Rural hospitals are, in many cases, because of the way that they're funded, they are operating kind of on they used to have a lot of dollars. A lot of them receive Medicaid funds. So with these gross cuts in Medicaid funds coming down from HR 1, you hear Republicans talking about all the money that they're giving to rural hospitals. What they're not saying is it's a third of what they typically would be giving to rural hospitals.
Yeah, it doesn't make up the difference.
Funding rural hospitals all across the country. And interestingly, in Louisiana, there are 38, more than any other state in this country, 38 rural hospitals are in danger of closing because of HR 1.
Doctor, I understand you were just right at the center of the fight against Wisconsin's abortion ban when you had to actually travel out of state to do your job. What was that about?
Yeah, so after the Dobbs decision in Wisconsin, we had a law from 1849, 1 year younger than the state itself. And it banned abortion for nearly every reason. And that seems like, well, just don't do abortions to, the average person. But to an OBGYN doctor or to anybody who's ever suffered a complicated pregnancy, We can't not do abortion care. It is part of miscarriage management. It is part of infertility care. It is part of helping people who have complicated, heartbreaking pregnancies. So, without being able to provide abortion services, we can't take care of our patients. I joined the Attorney General to push back on that. And as a result of that, my name appears on the judgment that brought abortion back to Wisconsin. I'm really proud of that. But anti abortion foes went after my medical license and filed an egregious complaint. I clearly was going to be a target here in the state where my family has been for 6 generations. So I had to move my practice. I drive 7 hours to work in a rural hospital in northern Minnesota.
Wow.
You're doing that.
7 hours.
You're doing that
Yeah.
now?
I have been for 3 years, and I have kids. I have 4 sons who live in my home who are holding the fort here. So, we're all making sacrifices. We're all doing what we can to pitch in and help each other out. Where I work, it's really hard to recruit doctors. There aren't enough doctors in this country, and we're not training enough doctors to replace the doctors who are leaving. This
That's
is
a
a crisis.
that's a longer story. We'd love to, arm you with a camera and just document what your life is like.
That's a fantastic
as a
idea
doctor in
and
a rural
tremendous
community.
perspective. Wonderful to hear that perspective, Dr. Kristin Lyerly. Thanks so much for coming on. Really appreciate it. Board Chair of the Committee to Protect Health. Wow.
Fascinating.
That is a real look
You thought
on
your
the
drive
ground.
was
And that's
long.
what we're doing on this show, is getting
Yeah.
a real look at what it's like across the country.